Hello everyone, my name is Ryan Turnbull and today I will be talking about an expanded function that a dental assistants that they perform. Um, I'm going to be talking about applying topical fluoride and varnishes. So I remember this as a kid. I actually loved getting fluoride and varnishes. I remember they used to bring a chart around and you could pick your flavors, and it was so relaxing when they would do it and when they were performing this treatment. And so that's kind of why I picked it. I always thought it was interesting. I thought it was fun and really relaxing. It was almost kind of meditation like almost for me. Um, so when you have your patient in front of you, as a dental assistant, you will be performing this as one of your expanded function. So when you have the patient in front of you, before you lie the patient back, you're going to want to explain the procedure. It's good to explain that it's a fluoride varnish, which is a type of fluoride. So it's pretty safe. That is meant to stay on the teeth for 6 hours. It's painted on the tooth with a brush. The fluoride hardens onto the teeth and it will naturally wear off. The purpose is it acts to slow demineralization and boost remineralizations, thus preventing infection, pain, and the need for fillings or surgical treatment. Reverse, retard, and arrest the process of cavity information as well, and it strengthens enamel. Some contraindications include children with a low risk of cavity information who consume optimally fluoridated water, or children who receive routine fluoride treatments through a dental office. Other contraindications include ulcerative gingivitis and stomatitis, known allergies or reactions to colophony or similar agents, avoid ingestion during application, not to be used as a systemic treatment. So the process, key steps, and this was, I was helped by Jennifer Semnewski. Hopefully I said that correctly. It's a YouTube video, and it's called, the video is How to Apply Fluoride Varnish. So I took some of that material and applied it to my explaining procedure. So the fluoride in the brush, it comes in an applicator packet. So I didn't have the actual applicator packet, but what I did was, so it looks like this, okay? And then you peel it back, and you have the red would be the brush, and then the blue would be the fluoride. And when you peel it back, this would be kind of like what the brush would look like. I indicated here this yellow rubber band would be a notch. And what that notch is used for is to help get back into those posterior teeth. It'll help extend and reach and allow you to, basically to get back there easier and allow you to perform your function in a correct way. And basically helps with the process of the treatment. Once the varnish is separated, the patient will be in a supine position, which means the patient lying down with face and torso facing upwards. The first step is, if the teeth are sensitive, wipe teeth with gauze, otherwise going to dry the teeth off with an air water syringe tip, which looks a lot like this, a straw. And so when you have the teeth, you're going to start with a maxillary arch first, and you're just going to suction it. And then you're going to do the mandibular arch next, just like that. Okay, and so now we're going to apply the varnish. So when applying the varnish, you're going to apply to the mandibular teeth first. And why we do this is to activate the salivary glands. So you're just going to coat it. And I peeled back the skin so you can see this better. And you want to get all the surfaces, get the occlusal, the buccal, and the lingual surfaces. So, the occlusal top, the buccal, which is on the cheeks, and then the lingual, which is near the tongue. So keeping the mouth open, you want to get that mandibular arch. Gauze can be used to wash off the tongue. And again, do not use the suction, because if you use the suction, this device, you could damage the instruments. Some precautions to treatment is one that I mentioned before, is remembering not to use suction when washing off the fluoride. Again, that damages the instruments, the equipment. It's not to be used as a systemic treatment. Relatively, this is a pretty safe, simple treatment. Again, I've had this done many, many times, especially as a child and growing up. Um, Hardly any fluoride is swallowed. Some people even like the taste. I did, and so that wasn't a big deal for me. Um, During the treatment, it is quickly applied and hardens. One of the worst things that actually can happen, which is not terrible, is your teeth may look yellow for a short period of time. Um, and that information was provided by healthychildren.org. Some patient op instructions. This was help provided by youngdental.com and another YouTube channel, MCC Dental. Um, so depending on when the visit occurs, if it's a morning visit, brushing teeth at night is okay. If it's an afternoon or a very late appointment, the recommendation is to wait until the next morning to commence teeth brushing. After treatment, it is usually encouraged to wait at least 30 minutes to allow the teeth to absorb the fluoride and help repair microscopic carious areas. That was provided by the ADA website. Follow-up visits are recommended every 3 to 6 and 12 months. So after the treatment, you want to avoid hard, crunchy foods and hot drinks for 4 to 6 hours or until the next day. Advisable to drink through a straw for the next few hours. And avoid brushing and flossing for 4 to 6 hours or until the next day as well. You also want to remove the next day. You want to remove excess traces of fluoride with a toothbrush and dental floss. All right, so now we have some potential risk that I'm going to explain. So you want to review the patient's medical history. This is before the exam occurs for any contraindications such as food and dye allergies. So let's talk about supervision for the dental assistant in this procedure. So the dental assistant is under the term of general supervision, which means you are following instructions given by a licensed dentist, but the dentist is not required to be physically present during the procedure. I think this is cool. I think this is good. Like I said, this is relatively simple treatment process. I don't believe you need direct supervision for this. I don't see many things happening that are bad, and through my research, I didn't see very, very many things or possibilities that could go wrong that would put anybody in danger or anything like that. So I don't think you shouldn't have any direct supervision. The dental system can handle this. It's a good function to have for them, and you can rock on with it. Yeah, so that concludes my discussion and topic for today on topical fluoride and applying varnishes. I hope you learned something and enjoyed it. Have a good day.